Welcome to our TechSphere podcast.
Thanks for tuning in.
Today we're diving into some fascinating research about a potential new treatment for sudden hearing loss. And
We're excited to unpack this with you.
it's amazing to think that there are people out there who wake up one morning and their world is suddenly silent, or at least much quieter.
Absolutely.
We're talking about sudden hearing loss, and it can be a truly disorienting and frightening experience.
Yeah, it's more common than you might think.
Really?
It can affect anyone at any age, and the impact on someone's life can be significant. Imagine not being able to clearly hear conversations, music, or even the sounds of nature.
Exactly. It's a big deal.
Yeah.
And right now the treatment options are limited, not always effective.
Right.
But there's some promising news on the horizon. We're diving into an article from Technology Networks published on November 7th, 2024,
Oh, very cool.
titled Active Substance Shows Promise for Treating Sudden Hearing Loss in Animal Models.
This research piqued our interest right away.
Yeah.
It focuses on a substance called AC102, and early studies suggest it could be a game changer for treating sudden hearing loss.
Okay, so let's break down this research. The study was conducted by Medical University of Vienna,
Okay.
and they were initially looking at ways to preserve hearing after cochlear implant surgery.
Interesting.
It turns out there's a connection there with sudden hearing loss. But first, can you explain what cochlear implants are and why this research is relevant?
Sure. Cochlear implants are incredible devices that can restore hearing for people with severe to profound hearing loss. They work by bypassing damaged parts of the inner ear and directly stimulating the auditory nerve. However, the surgery to implant them can sometimes cause further damage, potentially impacting any remaining natural hearing.
And that's where residual hearing comes in.
Precisely. Residual hearing is any natural hearing ability that remains after a cochlear implant. And it's really important because when combined with the implant, it can lead to better speech comprehension and overall hearing quality. It's like having a backup system.
So the researchers were essentially trying to find a way to protect that backup system during surgery,
Yes.
and they discovered AC102. What's remarkable is that the animals who received AC102 showed a significant recovery of their hearing after the procedure, unlike those who didn't get the treatment.
That's right. And when they dug deeper, they found that AC102 has strong anti-inflammatory properties. It seems to protect those tiny hair cells and auditory nerves in the inner ear, which are essential for hearing.
So how does protecting hearing during cochlear implant surgery relate to sudden hearing loss?
Well, researchers believe that similar inflammatory processes might be at play in both situations. Inflammation can damage the delicate structures in the inner ear, leading to hearing loss. And since AC102 was so effective at combating inflammation and protecting those structures, they believe it holds promise for treating sudden hearing loss as well.
I see. So the same mechanism that helps preserve hearing during surgery could also be the key to treating sudden hearing loss.
Exactly.
This is especially exciting because the current go-to treatment for sudden hearing loss, cortisone, isn't always effective, and it can have some unpleasant side effects.
Exactly. Cortisone is a powerful anti-inflammatory, but it doesn't work for everyone. And when it is used, it often requires high doses, which can lead to those unwanted side effects. So the potential for AC102 to be a safer and possibly more effective alternative is a big deal.
It definitely sounds promising. So where do things stand now with getting this treatment to people who could benefit from it?
The research is moving forward quite rapidly. There have already been preclinical studies specifically looking at AC102 for sudden hearing loss, and those have shown encouraging results.
And they haven't stopped at animal studies, right?
That's right. They've already completed a phase I trial in humans. This phase focused on safety and making sure AC102 wouldn't cause any harmful side effects. Now they're moving on to a phase 2 trial.
So for those of us who aren't familiar with the world of drug development, what exactly does a phase 2 trial involve?
A phase 2 trial involves testing the treatment on a larger group of people to see if it actually works against sudden hearing loss. It's all about determining effectiveness. This particular trial is taking place at multiple centers across Europe, including Medical University of Vienna.
So they're gathering real-world data to see how well AC102 works in humans. That's exciting progress.
It really is. And the fact that it's being tested at multiple centers suggests a robust and comprehensive approach to the research.
This AC102 seems like it could be a real game changer.
Yeah.
Not just for those experiencing sudden hearing loss, but potentially for people with cochlear implants as well. It's amazing how one research project can have such wide-reaching implications.
Absolutely. It highlights the importance of investing in scientific research and exploring new avenues for treatment. You never know where the next breakthrough might come from.
It makes you wonder what other possibilities are out there just waiting to be discovered. Okay, so we've covered the basics of the research and where things stand now. But before we go any further, I want to take a step back and really understand the impact of sudden hearing loss. Why should our listeners care about this?
That's a great point. It's easy to overlook the profound impact hearing loss can have on someone's life. It's not just about missing out on sounds, it's about the potential isolation, communication difficulties, and even safety concerns that can come with it.
And let's not forget the emotional toll it can take. Imagine the frustration of not being able to easily understand conversations, or the anxiety of feeling disconnected from the world around you.
Exactly. It's a multifaceted issue with far-reaching consequences. And that's why the potential of AC102 is so significant. It represents a real glimmer of hope for those struggling with this condition.
It sounds like we're on the verge of a potential breakthrough in hearing health. But before we get ahead of ourselves, let's delve a little deeper into the science behind AC102 and how it actually works.
I'm happy to explain. As we mentioned earlier, AC102 has powerful anti-inflammatory properties. But what's fascinating is how it specifically targets the inner ear, which is where the magic happens, so to speak.
Okay, I'm all ears. Tell us more about how AC102 works its magic in the inner ear.
Well, inside the inner ear, there's this incredible structure called the cochlea. It's shaped like a spiral and is filled with fluid. And within this fluid, there are thousands of tiny hair cells that are responsible for converting sound vibrations into electrical signals that our brain interprets as sound.
So these hair cells are basically the superstars of hearing.
Exactly. They're incredibly sensitive and delicate. And when they're damaged, whether by loud noise, aging, or inflammation, it can lead to hearing loss.
And that's where AC102 comes in.
Precisely. AC102 seems to protect these hair cells from damage by reducing inflammation. It also appears to have a protective effect on the auditory nerve, which is responsible for transmitting those electrical signals from the hair cells to the brain.
So it's like a double whammy of protection for our hearing.
That's a great way to put it. And that dual action is what makes AC102 so promising as a potential treatment for a variety of hearing conditions, including sudden hearing loss.
This is all incredibly fascinating.
Yeah.
So we've talked about sudden hearing loss, cochlear implants, and this potential new treatment, AC102. But I'm curious, how did this research even come about? What led scientists down this path?
It's a great question, and it speaks to the power of scientific curiosity. Often, breakthroughs come from unexpected places, and this research is a perfect example of that.
So spill the beans. How did this research get started?
Well, it all began with a group of researchers at Medical University of Vienna who were interested in improving outcomes for people receiving cochlear implants. They knew that preserving residual hearing was crucial for better hearing quality after surgery.
Right, because that natural hearing combined with the implant provides a much richer auditory experience.
Exactly. So they set out to find ways to protect those delicate structures in the inner ear during the implant surgery. And that's how they stumbled upon AC102. They were initially testing it for its ability to reduce inflammation and prevent damage to the hair cells and auditory nerve.
So it was a bit of a happy accident.
You could say that.
Yeah.
But it's also a testament to the importance of exploring all avenues and being open to unexpected findings.
I love that. It reminds us that science is all about exploration and discovery. Sometimes the most groundbreaking discoveries come from the most unexpected places.
Absolutely. And in this case, that unexpected discovery could have a profound impact on the lives of millions of people struggling with hearing loss.
This has been such an insightful conversation so far. We've covered a lot of ground, from the basics of hearing to the complexities of research and the potential of this new treatment, AC102.
It's been a great discussion, and I'm eager to see where this research leads in the coming years.
Me too.
Yeah.
And on that note, I think it's time for a quick break. When we come back, we'll dive even deeper into the potential of AC102 and what it could mean for the future of hearing health.
That's good.
We'll be back in a flash.
All right.
Welcome back to our TechSphere podcast, deep dive into the world of AC102 and its potential for treating sudden hearing loss.
It's great to be back, and I'm excited to continue exploring this promising research with you.
Before the break, we were talking about how AC102 works its magic by protecting those tiny hair cells and auditory nerves in the inner ear.
Yes, and it's worth emphasizing just how revolutionary that is. You see, for a long time, damage to these delicate structures was considered irreversible.
So there was no way to repair or regenerate those hair cells once they were damaged.
That was the prevailing belief. But this research with AC102 challenges that assumption and offers a glimmer of hope for restoring hearing function, even in cases where damage has already occurred.
That's incredible. It's like we're rewriting the rules of what's possible in hearing health.
Precisely. And it underscores the importance of continued research and exploration in this field. Who knows what other amazing discoveries are just around the corner?
It's mind-boggling to think about the possibilities. Now, we've touched on the fact that AC102 is being investigated not just for sudden hearing loss, but also for its potential in cochlear implant procedures. Can we delve a bit deeper into that aspect?
Absolutely. As we mentioned earlier, one of the goals of the initial research was to find a way to preserve residual hearing during cochlear implant surgery. And the success they've seen with AC102 in that context is truly remarkable.
Right, because even though cochlear implants are amazing devices that can restore hearing, it would be even better if people could retain some of their natural hearing in addition to the implant.
Exactly. Combining natural hearing with the electrical signals from the implant creates a much richer and more nuanced auditory experience. Imagine being able to appreciate the subtle tones of music or the nuances of human speech even more fully.
It sounds like a symphony of sound.
Yeah.
So could AC102 become a standard part of cochlear implant procedures in the future?
It's certainly a possibility. If further research continues to confirm its effectiveness and safety, I could envision it becoming a routine part of pre- or post-operative care.
That would be a game changer for people receiving cochlear implants, to know that we can not only restore hearing, but potentially preserve some of their existing hearing as well. That's truly remarkable.
It would be a paradigm shift in how we approach hearing loss and a testament to the power of personalized and preventative medicine.
It's like we're moving from simply reacting to problems to actively getting ahead of them. And this research is a prime example of how that shift is happening in the field of hearing health.
Precisely. It's about empowering individuals to take control of their hearing health and exploring all options available to them.
Speaking of empowerment, I think it's important to acknowledge the role of technology in all of this. I mean, without advancements in areas like cochlear implants and the sophisticated tools used to study the inner ear, we wouldn't even be having this conversation.
That's a great point. Technology plays an increasingly vital role in both understanding and treating hearing loss. And as technology continues to evolve, we can expect even more groundbreaking advancements in the future.
It's like we're on the cusp of a new era in hearing health. And AC102 is just one example of the incredible possibilities that lie ahead.
I couldn't agree more. It's an incredibly exciting time to be following this field, and I, for one, am eager to witness the unfolding of the next chapter.
Me too. But before we get carried away with future possibilities, let's bring it back to the present and talk about the next steps for AC102. We know that the Phase 2 trial is currently underway, but what happens after that?
Well, assuming the Phase 2 trial yields positive results, the next step would be a larger-scale Phase 3 trial to confirm the effectiveness and safety of AC102 in a larger and more diverse patient population.
And then if all goes well, it would go through the regulatory approval process.
Exactly. In the United States, that would involve submitting an application to the Food and Drug Administration, or FDA, for approval to market AC102 as a treatment for sudden hearing loss. Similar processes would take place in other countries as well.
So we're looking at a multi-year process, even in the best-case scenario.
That's correct. Bringing a new drug to market is a complex and rigorous process, and rightfully so. It's essential to ensure that any new treatment is both safe and effective before it becomes widely available.
While we wait for these trials to unfold, is there anything people can do to protect their hearing now?
Absolutely. There are many things people can do to minimize their risk of hearing loss, such as avoiding exposure to loud noises, wearing hearing protection when necessary, and getting regular hearing checkups.
Those are all excellent tips. We'll be sure to include some helpful resources on hearing health in the show notes for our listeners.
Great idea. And remember, even if you're not experiencing any hearing problems now, it's crucial to be proactive about protecting your hearing for the long haul.
Our hearing is such a precious sense, one that we often take for granted until it's compromised.
Very true. The good news is that there's a lot we can do to safeguard our hearing health throughout our lives.
This conversation has been incredibly enlightening. I feel like I've gained a much deeper understanding of hearing loss, the intricacies of the research process, and the immense potential of AC102.
I'm delighted to hear that. It's always rewarding to share knowledge and spark curiosity in others.
Before we wrap up, is there anything else you'd like to add?
Just that I believe this research exemplifies the remarkable power of science to push the boundaries of what's possible. Who knows what other groundbreaking discoveries await us in the years to come?
That's a fantastic point to ponder.
Right.
We truly live in an age of incredible scientific advancements, and it's thrilling to contemplate the future possibilities.
Indeed. And I share your optimism for the future of hearing health.
Well said. And on that note, let's express our gratitude to our listeners for joining us on this deep dive into the world of AC102 and the future of hearing health.
And a huge thanks to all our listeners for tuning in. Don't forget to like, subscribe, and share this episode with your friends. We'll be back soon with another deep dive into the latest scientific discoveries. Until then, keep exploring, keep learning, and keep those ears healthy.
And to our listeners who are eager to learn more, we'll be sure to include links to the original article from Technology Networks and other valuable resources in the show notes.
Good idea.
Now, before we sign off, I want to leave you with a thought-provoking question to ponder. Imagine a world where sudden hearing loss is no longer a life-altering event. A world where an effective treatment like AC102 is widely available.
It's a powerful vision, isn't it? A world where that sudden silence, that wave of fear and uncertainty is no longer the reality for so many people.
What kind of impact do you think that would have, not just for individuals, but for society as a whole?
That's a fascinating question. It makes you think about the ripple effects, doesn't it? Improved communication, greater social inclusion, enhanced quality of life, and perhaps even economic benefits as people can remain active and engaged for longer.
It's inspiring to think about the possibilities. And it speaks to the power of scientific research to truly make a difference in the world.
This research with AC102 is a testament to human ingenuity and our unwavering pursuit of solutions to improve lives. It's a beacon of hope for those seeking answers and relief.
Thanks for joining us on this deep dive into the promising world of AC102 and the future of hearing health.
And a huge thanks to all our listeners for tuning in. Don't forget to like, subscribe, and share this episode with your friends. We'll be back soon with another deep dive into the latest scientific discoveries. Until then, keep exploring, keep learning, and keep those ears healthy.